Today, across CBS News, we've been taking an in-depth look at America's mental health crisis. We call our initiative Stop the Stigma. Nearly 4 million people in this country with severe mental illness go untreated. They are 16 times more likely to be killed during an encounter with police. Omar Villafranca shows us how one city is trying to change that.
There's a guy on River Road who I think would benefit from having CAHOOTS come visit him.
When a mental health-related 911 call comes in,
Royal Avenue,
a specialized team in Eugene, Oregon rolls out.
pretty much everybody we see is, for one reason or another, in a state of crisis.
Manning Walker is a medic, and Laurel Lisovskis is a mental health crisis manager. The pair are members of CAHOOTS, crisis assistance helping out on the streets. They answer calls like suicide interventions and overdoses. They're unarmed, and most of the time, without police backup.
We always move as a team. Whoever is talking and making contact, the other person is observing.
They took our CBS crew on an exclusive ride-along. Their first call was for a woman they'd met before. They believe she's schizophrenic. She told us her name was Kayla.
Would you rather deal with someone with CAHOOTS or like a uniformed police officer?
Definitely CAHOOTS.
How come?
They don't, help you when you're in the time of need or when you're hungry or certain things like that.
CAHOOTS was founded in 1989. Last year, they responded to nearly 23,000 calls in Eugene and Springfield, Oregon. Denver is starting their own version of CAHOOTS. City leaders from Oakland, Olympia, Washington, and even New York City are all considering similar pilot programs. Tim Black is CAHOOTS operations coordinator.
We handle almost 20% of the entire external public safety call volume for our area. But there was such a dramatic need coming in through the 911 and non-emergency lines that there was a need for there to be this kind of behavioral health first response.
Let them know that you're out of your meds.
CAHOOTS team members are trained to de-escalate when responding to a mental health crisis.
Thank you guys so much.
A recent study found 25 to 50% of fatal officer-involved shootings involve someone with a severe mental illness. Eugene's police chief, Chris Skinner.
They don't need jail. What they need is they need to be able to be de-escalated from their crisis. They need a ride to a mental health facility or to a medical care facility or wrapped around with services. That's what the people need. They don't need to be going to jail every time.
A new way to protect and serve, and maybe save a life. Omar Villafranca, CBS News, Eugene, Oregon.
And there is much more CBS News coverage on the mental health crisis tonight on CBS News Radio and our digital platform, CBSN and CBSNews.com.